Medical malpractice. I think we've all heard of it. A bad time in the ER, not due to any sort of injury this time, or an ill intentioned medical practitioner just looking to get you out of their hair. We've all encountered situations in which we hear about medical malpractice day to day. But when and why did us caring for this type of act begin, both in terms of the law and in individual case studies? We have found that as early as 754 BCE, in one of the first recorded laws, that medical malpractice, intentional harm during surgeries, could be fiercely punished and reprimanded. This was further developed by Hippocrates, the father of Western medicine, in ancient Greece during the 5th century BCE, who developed an oath now dubbed the Hippocratic Oath, still practiced in modern day by most doctors. The 19th century saw a mass increase in medical malpractice cases in courts of law, typically originating from claims that a person's injuries could be cured fully through surgeries, without the ability to make true on these claims. This contributed to the development of the American Medical Association, who developed the first national code on how to practice medicine and surgeries ethically and lawfully. It detailed uniform, training, and education practices. A major downside of the state of the medical world at this time was the lack of knowledge on the intricacies of the human body, and what was best to preserving people's lives in place of limbs and appearances. This was also followed by constant reforms to fine-tune the laws regarding these practices, legislations being passed to limit the risk of incorrectly performed procedures and updates on the safest way to perform certain surgeries. Interestingly, doctors are rarely seen as responsible in the modern day for medical mishaps. This is a stark contrast to some past medical procedures, often entirely in the hands of the performing doctor. One such occurrence of this being the lobotomy. Starting in the 1930s, but finding its origins in 1880 in Switzerland, when physician Gottlieb Burckhardt operated on 6 suspected schizophrenics in an attempt to calm them rather than to cure them, 2 dying afterwards, one of which of suicide. They were subdued and tranquil following the procedure, this making history in brain surgeries as a whole, beginning a trend in doctors taking the safety of a patient in their own hands without the patient's best interests in mind. See the treatment of this procedure as an experiment more so than a last-ditch resort, as well as its continued practice after evidence made it clear life was easier for a patient's carers. His discoveries remained stagnant in use up until 1935, when Portuguese brain scientist Antonio Egas Moniz attempted a procedure in which holes were drilled into the prefrontal cortex of a patient before pouring alcohol inside to destroy and disrupt neuronal tracts. This was, akin to the first procedures of its time, performed on exclusively mentally ill people with a focus on those battling paranoia and schizophrenia, believing symptoms of anxiety and brain function to lessen afterwards. In what may seem as equal parts materialistic and innovative, the leucotome was developed, a device akin to a needle with a retractable metal wire hoop that was made to be inserted into the drill hole and pick away at brain tissue in its vicinity. Ironically, Walter Freeman, the man who developed a more advanced version of lobotomies, named his own device after leucotome, this version modeled after an ice pick with a less complicated insertion. It served as competition to Moniz' leucotome, gaining more popularity through his charisma and the public's inability to consistently prove that lobotomies are more harmful and unnecessary than of possible benefit. Walter Freeman would quickly become the man most associated with and credited for lobotomies, despite not having developed them. He sought to constantly develop the practice behind lobotomies to make them as widely available as possible, these methods obviously also being more dangerous. Due to Walter's beloved reputation, more akin to a celebrity than medical practitioner, the downsides of his surgeries on his patients were heavily underreported. Patients became easier to care for in almost all cases due to having less brain function, but typically became apathetic, passive, without initiative, or ability to have prolonged thought entirely. This sometimes manifesting in lobotomy survivors committing suicide following the procedure. Walter Freeman was awarded the Nobel Prize for Medicine in 1949. Despite this, being given it due to his advancements in brain surgery, his reputation is also visible through his role as having been the one to give American President John F. Kennedy's sister, Rosemary Kennedy, a lobotomy in 1941, earlier in the decade. His faults as a brain surgeon being visible even then after the surgery's failure, leading to her losing the ability to walk, talk, or read for the remainder of her life. Freeman's lack of skill in the procedure came to fruition in 1967, in which his privileges to perform surgeries were revoked after a patient died of an internal brain hemorrhage after her third lobotomy, proving for the final time that the operation was too harmful and that he had not put enough care into his patients to prevent these type of fatalities. Lobotomies had mostly been out of the limelight already, losing mass attraction in 1955, when less grotesque methods of treating mental illnesses, which were not understood in detail at the time, came out. However, lobotomies had already been banned and limited in many countries before this culture shift, initially being completely outlawed by the Soviet Union in 1950 due to the procedure being, quote unquote, contrary to the principles of humanity, marking it as the first region to ban the lobotomy. From this, we can see that before our current advancements in modern medicine and modern technology alike, the misconduct against patients, typically those belonging to minorities, was extremely overlooked and even rewarded in the case of Walter Freeman. Our modern climate and more heavy presence of social justice in the world today helps prevent this inhumane treatment of others. We can only look towards the future to hope medical malpractice in the hands of the improperly educated practitioners can end entirely.